Hi, I'm Daniela Osores, and I'm here to present a study of the prevalence of HTLV-associated uveitis in patients of Salvador, Brazil. HTLV-associated uveitis is an inflammatory reaction of the choroid, retina, optic nerve, and vitreous that can lead to visual deterioration. The prevalence of AJU varies from 1.61 to 14.5% worldwide, and from 1.9 to 2.85% in Brazil. The uveitis can be categorized in anterior, intermediate, posterior, and panuveitis. The presentation is insidious onset, mono or binocular, recurrent episodes, and intermediate location. The symptoms are common floaters and blurred vision or asymptomatic patients. The signs observed: iritis, endothelial PKs, vitreous opacities, retinal vasculitis, macular edema, retinal exudates, and hemorrhages. The objective of this study is to determine the prevalence of AJU in HTLV-1 infected patients and to describe the types of the uveitis and associated symptoms. This was a cross-sectional analytical study. Medical records of infected and uninfected individuals who underwent ophthalmologic examination for diagnosis of uveitis were analyzed. We adopted this inclusion and exclusion criteria. Results: the proportion of women was 81.9% in exposed group and 65.4% in an exposed group. And the mean of the age exposed and unexposed patients was 54.5 and 62.6 years old, respectively. The prevalence of uveitis in exposed patients was 7%, and the prevalence in unexposed patients was 0.73%. Bilateral intermediate uveitis associated with symptoms of visual disturbance and floaters was most common in unexposed patients, and unilateral panuveitis associated with symptoms of blurring and eye pain was more common in an exposed group. In this picture, we see some signs of uveitis in patients of this study. In conclusion, the prevalence of uveitis in patients with HTLV-1 was higher than the previous national studies, and these results may be related to a more specific diagnosis method. The prevalence of uveitis in patients with HTLV-1 is higher than in general population, not HTLV. The uveitis in patients with HTLV-1 was frequently bilateral and intermediate, and the patients were asymptomatic or presented few symptoms. Thank you so much. Have a nice day.